CNA Written Practice Test 2026. Question 1. Which of the following is the most appropriate time to use a soft toothette? When a resident is complaining of a toothache. When a resident is having a seizure. When a resident has dentures. When giving an unconscious resident mouth care. An unconscious resident is in danger of aspirating fluid or toothpaste. Soft toothettes are generally used for oral hygiene in patients who cannot tolerate a standard toothbrush or are at risk of choking. Question 2. A resident is recovering from a stroke and has weakness on their left side. Assistance with a sweater should be given behind the resident, in front of the resident, on the resident's left side, on the resident's right side. Assisting on the side that is the weakest, the affected side, offers essential support and helps the resident maintain their balance during the task. Question 3. Which of the following would be an inappropriate action when providing nail care to a resident? Use lots of lotion between fingers and toes to help prevent dryness. Use extra caution if you trim the nails of diabetic residents. Thoroughly dry the fingers and toes to prevent skin breakdown. Soak the resident's hands or feet in warm water before trimming. While lotion prevents dryness, it should never be placed between fingers or toes because the moisture can promote bacterial or fungal growth. Special care is always required for diabetic residents due to poor circulation. Question 4. It is time to bathe an Alzheimer's patient who has had visitors for most of the shift. What is the most appropriate action? Ask the charge nurse to speak with the visitors. Ask the visitors to step out until the bath is complete. Ask the patient when you should come back. Perform the bath as your first task the next day. Nursing assistants are responsible for ensuring patient privacy and completing ADLS. Since visitors have been present for most of the shift, it is appropriate to politely ask them to step out so care can be provided. Question 5. A resident on the DASH diet reduces food intake and shows little interest in eating. How should the nursing assistant handle this? Call the staff nutritionist. Try to persuade him to eat more. Check the resident's prescribed dietary supplements and provide them. Ask the family to bring favorite foods from outside. The immediate role of the nursing assistant is to provide prescribed supplements to ensure nutrition. Changes to diet or family-brought food must be approved by a nurse or physician to ensure DASH diet compliance. Question 6. To obtain the most accurate patient weight, the nursing assistant should weigh the patient directly after a meal, with 2 different scales, 3 to 4 hours after eating, at the same time every day. Weighing a patient at the same time every day, preferably in the morning before breakfast, provides the most accurate comparison of weight trends by minimizing variables like food intake. Question 7. A nursing assistant is instructed to take the oral temperature of a patient who just had a cold drink. The temperature should be taken 3 to 5 minutes after the drink, 15 minutes after the drink. Immediately, cold drinks do not affect readings, 20 to 30 minutes after the drink. A delay of 15 to 20 minutes is necessary for the oral cavity to return to its baseline temperature after the consumption of hot or cold liquids to ensure an accurate reading. Question 8. Where should the nursing assistant remove a gown and gloves after caring for a patient on isolation? In the dirty utility room, in the hallway, in the current patient's room, in the next patient's room. PPE should be removed inside the patient's room near the exit to prevent the spread of pathogens from the contaminated environment into the hallway or other patient areas. Question 9. Another term for a decubitus ulcer is pressure sore, perforation, ulcerated cyst, ulcerated tumor. Pressure sore or pressure injury are the common terms for decubitus ulcers, which are localized injuries to the skin and underlying tissue caused by prolonged pressure. Question 10. Why is taking a resident's oral temperature the most common means of obtaining a reading? It is the only method residents will accept. It is the most cost-effective method. It offers the most ease of access and least inconvenience. It is more accurate than other methods. Oral temperature is preferred because it is non-invasive and provides a reasonably accurate core temperature reading with minimal discomfort to the resident. Question 11. As dementia progresses, incontinence can become an issue. How can the nurse aide assist? Avoid outings to minimize accidents. Remind the resident to tell you when they need to go. Start using adult diapers immediately. Watch for signs of discomfort or restlessness. Anticipating needs by watching for nonverbal cues, restlessness, pulling at clothes, and establishing a regular toileting schedule is more effective than waiting for a confused resident to request help. Question 12. When getting dressed, a client always wants to wear her favorite outfit. What is a good solution? Hide the favorite outfit for a few days. Tell the resident the outfit is dirty. Ask the family to get several identical outfits. Explain the benefits of variety and offer other choices. For residents with dementia, consistency reduces confusion. Having multiple identical outfits allows the resident to wear what they feel comfortable in while maintaining hygiene. Question 13. A confused resident thinks he needs to leave for work at 5 a.m. The best response by the nurse aide is to ______. Tell him residents are not allowed in the nurse's station. Remind him that he is retired and in a nursing home. Ask the resident about his job and if he is hungry. Help the resident back to his room and into bed immediately. Using validation and redirection is best. Acknowledging their reality, his job, and then redirecting him to a current activity, breakfast, reduces agitation compared to arguing with his reality. Question 14. A resident who has not been discharged insists she is going home. What should the nurse aide do? Notify the charge nurse immediately. Put her in physical restraints until she calms down. Tell her she cannot leave without a doctor's order. Advise her that she can leave if she wants to. If a resident attempts to leave against medical advice, AMA, the nurse aide must notify the supervisor immediately. It is outside the aide's scope of practice to handle legal discharge issues. Question 15. When caring for a confused resident, what should a nursing assistant do? Say nothing to avoid more confusion. Give simple directions. Allow the resident to plan all daily activities. Give the resident complex tasks to keep them busy. Confused residents process information slowly. Using short, simple sentences and clear directions helps them understand and reduces the likelihood of frustration or agitation. Question 16. It is appropriate for the nursing assistant to share personal client information with ______, the client's wife, the client's children, the client's roommate, the nursing assistant on the next shift. Under HIPAA, medical information should only be shared with the healthcare team members directly involved in the patient's care. Family members require specific authorization to receive medical details. Question 17. It would not be appropriate to share healthcare information about a resident with ______, the physical therapist, the physician, the charge nurse, the resident's best friend who visits weekly. Confidentiality must be maintained at all times. Friends and unauthorized visitors are not entitled to a resident's private health information regardless of their relationship. Question 18. A resident wishes to be seen by a different doctor. Your response should be ______. Tell the resident they cannot change physicians. Tell the resident their current doctor is the best. Acknowledge concerns and suggest a provider you like. Help the resident contact the social worker or RN for assistance. Residents have the right to choose their own physicians. The nurse aide should facilitate this right by involving the social worker or RN who can handle the administrative process. Question 19. If a resident's file contains the initials DNR, it means ______. Decision not recorded. Do necessary resuscitation. Do not resuscitate. Do not record. DNR stands for do not resuscitate. This is a legal order indicating that the resident does not want CPR or advanced life support if their heart stops or they stop breathing. Question 20. Which of these does not show caring behavior? Making extra stops to talk to a lonely resident. Asking a coworker to finish your duties so you can go to lunch. Listening to a resident concerned about a procedure. Checking on a resident who is crying. A caring professional prioritizes the needs of the residents. Leaving tasks for others solely to prioritize one's own break time does not demonstrate a resident-centered approach. Question 21. The nurse asks you to ambulate a patient bid. This means you will walk the patient ________, 4 times a day, 3 times a day, 2 times a day, once a day. BID is the medical abbreviation for bis in die, which means twice a day. TID is 3 times, and QID is 4 times. Question 22. Which behavior exhibits the best listening skills? Directing the conversation based on your own experience. Asking questions that direct the conversation further. Continuing to work while the resident talks. Turning in the resident's direction and responding appropriately. Active listening involves giving the speaker your full attention, making eye contact, and providing appropriate verbal and nonverbal feedback. Question 23. What is the most important first step when beginning a procedure on a patient? Enter the date in the medical record. Document what you did. Provide privacy. Verify the resident's identification. Patient safety begins with correct identification. You must ensure you are performing the correct procedure on the correct person before taking any other action. Question 24. If a resident is completely deaf, which is most important for communication? A laptop or pen and paper? A loud voice that projects? An alarm that rings louder than normal? A phone system with amplifiers? For a resident with total hearing loss, visual communication via writing is the most effective and reliable method for exchange of information. Question 25. When you are documenting in a medical record, which of these is not part of the process? Author identification. Using correct spelling. Dating your entries. Writing in pencil so erasures can make the record clean. You must consider that a medical record is a legal document. Entries are not erased. The other options are part of the process. Question 26. A resident in your care is frustrated, upset, and raising his voice. Which of these is the best response? Report the incident to the supervising nurse. Walk away to show you won't tolerate the behavior. Offer support and care using a comforting and calming manner. Ask the resident to lower his voice in courtesy to others. Offering support and care to an unruly resident shows concern for his or her needs. A comforting and calming manner is a positive response that avoids escalating agitation. Question 27. When a patient is dying, the last of the 5 senses the patient loses is ________. Hearing, touch, taste, sight. Hearing is widely believed to be the last sense lost during the dying process. It is important to continue speaking to the patient and encouraging family to do the same. Question 28. A resident has just received news of a death in the family. What is the best way to assist them with the grieving process? Tell the resident about an experience you had with death. Remind the resident that death is inevitable. Spend some time with the resident, particularly offering support if they wish to talk. Suggest the resident get their mind off things with a pleasant thought. Sitting quietly and listening makes the resident feel comfortable enough to talk through their feelings. The other options tend to discount the resident's immediate feelings of despair. Question 29. Elizabeth Kubler-Ross describes the stages of grief. She believes the first stage of the grieving process is _______, acceptance, anger, depression, denial. Kubler-Ross identified the 5 stages of grief as denial, anger, bargaining, depression, and acceptance. Denial is typically the first reaction to loss. Question 30. As a nursing assistant, you may encounter residents who are anxious. The best response in dealing with this anxiety is to _______. Open the shades to let in more light. Leave the room so the resident can regroup in private. Speak in a calm voice and exhibit a calm and comforting demeanor. Turn on the radio or television to distract the resident. Reducing stimuli during anxious times brings relief. A nursing assistant's calm voice and demeanor provide reassurance and security in a tense environment. Question 31. While emptying the trash, you get stuck by a needle. What is the first thing to do? Call your personal physician. Wash the site for several minutes with soap and water. Fill out an incident report. Try to squeeze blood out. Immediate first aid for a needle stick is to wash the area thoroughly with soap and water for several minutes to reduce the risk of infection, followed by reporting the incident. Question 32. Infection control practices that prevent the transmission of disease are called isolation protocols, policies and procedures, standard precautions, hand hygiene mandates. Standard precautions, formerly universal precautions, are used globally to protect patients and staff from pathogens in blood, body fluids, skin, and mucous membranes. Question 33. Blood-borne infections include chicken pox, pneumonia, hepatitis, measles. Hepatitis is a serious condition transmitted by blood, typically sharing needles or needle sticks. Pneumonia, chickenpox, and measles are primarily airborne or droplet diseases. Question 34. Used disposable supplies and equipment should be discarded outside the resident's room, in a designated receptacle, in the resident's wastebasket, in the clean utility room. Contaminated items must be placed in specific biohazard or designated containers to prevent cross-contamination and ensure proper disposal according to facility policy. Question 35. To prevent the spread of infection, how should soiled linens be handled? Shake them in the air to remove dirt. Carry them close to the nurse aide's body. Put them in the dirty linen container. Place them in a neat pile on the floor. Soiled linen should be rolled away from the body and placed directly into a laundry bag. Shaking linens can release microorganisms into the air. Question 36. Which of these examples would not be considered neglect? Forgetting to provide a resident with enough water. Leaving clutter on the floor where a resident walks. Leaving the floor after clocking in for a legitimate reason. Forgetting to move an immobile resident to prevent bed sores. Neglect involves failing to provide necessary care or safety. Leaving the floor for a legitimate reason, with proper notification, is a scheduling issue, not clinical neglect. Question 37. The charge nurse has administered a prescribed medication to the wrong patient. This is an example of malpractice, neglect, battery, assault. Nursing malpractice occurs when a healthcare professional fails to perform medical duties according to the standard of care, resulting in potential or actual harm. Question 38. A nursing assistant threatens to slap a resident if he doesn't stop yelling. This is classified as battery, assault, slander, libel. Assault is defined as a threat of harm or creating a fear of touch. Battery is the actual physical act of harming or touching someone without their consent. Question 39. A resident's family hands you an envelope with a monetary gift. The best response is to accept the gift and give the resident extra attention. Accept the gift and check with colleagues. Thank the family but use the money for a resident gift fund. Thank the family but decline until you check supervisor/facility policy. Professional ethics prohibit accepting money or expensive gifts from residents to maintain professional boundaries. One must always follow specific facility policies regarding gifts. Question 40. There is a contained fire in the resident's room. What is the first action to take? Pull the fire alarm. Yell for help. Move the resident to safety. Grab the fire extinguisher. Safety of the resident is always the number one priority. Using the RACE acronym, Rescue Moving People from Danger, is the very first step. Question 41. A resident has suffered a stroke. The best position for helping them with ambulation is on the resident's side that is unaffected. On the resident's side that has been affected by the stroke. In back of the resident. In front of the resident. Supporting the resident on their weak, affected side provides the best stability and allows the aide to catch or support them if they begin to lean or fall. Question 42. When performing care activities, gloves should be worn When performing pericare. When you are changing a resident's clothing. When you are feeding a resident. When you are helping with ambulation. Pericare increases the likelihood of exposure to blood or bodily fluids. Gloves are required per standard precautions when contact with body fluids is anticipated. Question 43. A nurse asks you to perform something stat. This means do it as soon as possible. Before your shift ends. Ask the nurse to do it instead. Immediately. Stat is used for emergencies or urgent situations where a resident's safety or health is at immediate risk. It requires immediate action. Question 44. The best source of vitamin D is found in which of these foods? Apples, bread, steak, milk. Milk and other dairy products are typically fortified with vitamin D, which is essential for bone health and the absorption of calcium. Question 45. In which of these examples would refusal to do a task be acceptable? Task that you don't feel needs to be done. A task you have already done numerous times. A task that should not be done by a nursing assistant, out of scope. A task that is not normally assigned to your shift. A nursing assistant must refuse tasks that are legally outside their scope of practice, example, giving medications, to ensure resident safety and maintain their certification. Question 46. There is an order to give a female patient a shower, but she refuses. The nurse aide should threaten to use restraints. Take the patient to the shower anyway. Tell her that she must do what is ordered. Document in the chart that the patient refused to shower. Competent residents have the right to refuse care. The aide should document the refusal, inform the nurse, and perhaps offer an alternative such as a bed bath. Question 47. When transferring a heavy resident for the first time, the aide should do it alone to save time. Teach the resident to do the transfer alone. Review the care plan or check with the nurse. Tell the resident they are too heavy. Every resident has an individualized care plan that specifies the number of people and types of equipment, like a mechanical lift, needed for safe transfers. Question 48. To refresh your memory on a procedure like a soap suds enema, SSE, you should refer to the Patient Care Plan, Policy and Procedure Manual, Disaster Plan, MSDS Manual. The Policy and Procedure Manual contains the facility's approved step-by-step instructions for clinical tasks to ensure they are performed safely and correctly. Question 49. You are pushing a resident in a wheelchair when a call light lights up. The aide should Park the patient safely, lock wheels, and answer the light. Continue pushing and assume someone else will answer. Put the patient back to bed first. Take the patient into the other room with you. Prioritizing care and teamwork are essential. Ensure your current resident is in a safe, locked position before responding to the emergency of another resident. Question 50. To prevent dehydration of the client, the nurse aide should feed the client salty food to increase thirst. Offer fluids frequently while the client is awake. Use moisturizing lotion to keep skin intact. Wake the client during the night to offer fluids. The most effective way to maintain hydration is to offer a variety of fluids frequently during waking hours, ensuring they are within reach of the resident. Question 51. You've been asked to perform passive range of motion (PROM) exercises. The best example is underscore 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 underscore. Resident moves their own arm while you watch. Using resistance weights on a resident. Gently holding the resident's arm and moving it for them. Having the resident lift small objects. Passive range of motion is performed by the caregiver for a resident who cannot move their own joints. The aide moves the limb smoothly through its range without the resident's help. Question 52. Using proper body mechanics is essential. The muscles most prone to injury are in the underscore 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 back, leg, arm, neck. Lower back muscles are highly susceptible to strain. To avoid injury, nursing assistants should lift with their legs, keep a wide base of support, and keep the load close to the body. Question 53. The best way to encourage a resident's independence is to underscore 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 underscore. Let the resident begin the routine and then assist as needed. Leave the room so the resident is forced to start alone. Wait until the resident is soiled to motivate them. Let resident roommates help one another. Promoting independence involves allowing the resident to do what they can for themselves and only stepping in to assist with tasks they find difficult. Question 54. An assisting device does not help with underscore 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 underscore. Moving around, eating, dressing, restraining. Assisting devices, canes, adaptive utensils, reaching tools, are meant to increase independence. Restraints are restrictive and limit a resident's freedom of movement. Question 55. When a resident has a rehabilitation plan of care, your role may be to underscore 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 underscore. Do more tasks for the resident than usual. Assist with retraining and reinforcing skills. Administer pain medications. Give the resident shorter times to speed up recovery. In rehabilitation, the goal is for the resident to regain function. The nursing assistant's role is to encourage the resident and assist them in practicing the skills they learn in therapy. Question 56. The most common cause of accidents in the home or facility results from underscore 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 underscore. Falls, lacerations, abrasions, burns. Falls are the leading cause of injury-related deaths and accidents in the elderly. Preventive measures like clear walkways and proper lighting are crucial. Question 57. Mrs. Jones has been vomiting for days and is pale, lethargic, and has dull eyes. She is likely suffering from underscore 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 underscore. Congestive heart failure, hypovolemic shock, fecal impaction, multiple sclerosis. Severe fluid loss from vomiting can lead to hypovolemic, low volume, shock. This is a medical emergency where the heart cannot pump enough blood to the body. Question 58. A resident tells you he is tired of living and has been saving his pain pills. What should you do? Search his belongings for the pills. Notify the nurse and stay with the resident. Make him give you the pills and flush them. Ask him why he feels his life is worthless. Suicide threats must always be taken seriously. The immediate steps are to ensure the resident's safety by staying with them and notifying the nurse for evaluation. Question 59. A patient chokes while eating and is unable to cough or speak. The first thing to do is underscore 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 underscore. Call for the nurse and wait. Attempt to remove the obstruction with your fingers. Tilt the head back and give 2 breaths. Perform abdominal thrusts, Heimlich maneuver. If a resident cannot cough or speak, they have a full airway obstruction. Abdominal thrusts are the standard emergency procedure to dislodge the object. Question 60. The fire alarm has sounded. The nurse aide should first underscore 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 underscore. Report to the charge nurse. Make sure residents are out of hallways and close all doors. Take a fire extinguisher to the nurse's station. Notify the fire department. Closing doors, containment, and clearing hallways are critical first steps in fire safety to prevent the spread of smoke and keep emergency exit paths clear. Question 61. A resident is late to therapy because she eats slowly. What is the best action? Bring the resident to breakfast earlier. Take her plate away when it's time for therapy. Withhold breakfast until after therapy. Begin feeding the resident yourself. Bringing the resident to breakfast earlier allows them to maintain their independence by feeding themselves while still adhering to the facility's therapy schedule. Question 62. Which of these is an incorrect procedure for shaving a resident? Use a towel around the resident's chest. Shave upward on the neck. Shave upward from the chin to the sideburns. Check for bleeding disorders first. When shaving a face, you should shave in the direction of hair growth, downward, to prevent cuts and skin irritation. Shaving upward from the chin is incorrect. Question 63. Which of these may depend on facility rules when performing nail care? Soaking feet before starting. Reporting blue nail beds to the nurse. Nail care can be done in a chair or bed. The policy on cutting toenails. Because of the high risk of infection and injury, especially for diabetics, many facilities restrict toenail cutting to nurses or podiatrists. Question 64. A Hoyer lift is primarily used for moving a resident to a stretcher, moving a resident to a chair, moving a resident into a bathtub, moving a resident into a vehicle. A Hoyer lift is a mechanical safety device used to transfer residents who are non-weight bearing from their bed to a chair or wheelchair. Question 65. Morning care, AM care, before breakfast is important because it provides a pleasant appearance. It adds to a resident's sense of well-being. It helps to decrease harmful bacteria. All of these are correct. Morning care promotes hygiene, self-esteem, and physical health by removing bacteria and helping the resident feel ready for the day. Question 66. Bad breath, tooth decay, and skin breakdown in the mouth are symptoms of dry mucous membranes, overly moist mouth, dehydration, inadequate toothpaste. Dry mucous membranes, xerostomia, allow bacteria to build up, which leads to halitosis, decay, and painful sores in the mouth. Frequent oral care is required. Question 67. A small, watery leakage of stool could indicate which condition? A GI infection, a medication reaction, a fecal impaction, pelvic muscle weakness. A fecal impaction is a hard mass of stool stuck in the rectum. Watery stool from higher up in the colon leaks around the mass, appearing as diarrhea. Question 68. Which of the following is not considered personal protective equipment? Masks, face shields, and goggles. Hand washing equipment, gowns, gloves. While hand hygiene is the most important part of infection control, it is a clinical procedure. PPE refers specifically to wearable barriers like gloves and gowns. Question 69. Which term expresses the ethical principle of doing good for the patient? Confidentiality, beneficence, non-maleficence, veracity. Beneficence means to act in a way that benefits others. Non-maleficence means to do no harm, and veracity refers to telling the truth. Question 70. When bathing a patient, the nursing aide should not wash the dirtiest area first. Use an assistive device. Apply non-prescription ointments afterwards. Use standard precautions. To prevent cross-contamination, a nursing assistant must always wash from the cleanest areas, like the eyes and face, to the dirtiest areas. Question 71. At what point is cognitive dysfunction considered dementia? When there is depression and memory loss. Anytime there are memory or language problems. When bodily functions are also impaired. When difficulties have persisted for over 6 months. Dementia is a chronic, progressive condition. Clinical diagnosis usually requires that symptoms, memory loss, language issues, persist for at least 6 months. Question 72. A respiration rate of less than 12 breaths per minute in a patient may be caused by respiratory distress, use of narcotics, pain or stress, an infection. Narcotics, opioids, are central nervous system depressants that can slow the respiratory drive. Distress, pain, and infection usually increase the respiratory rate. Question 73. A patient refuses visitors, is withdrawn, and has bruises. What should you do? Report suspected abuse according to facility policy. Try to get the patient to see the visitors. Talk to the patient about their fears. Mention this casually to the nurse. Bruising and behavioral changes are red flags for abuse. A nursing assistant has a legal and ethical duty to report these observations through the proper clinical channels immediately. Question 74. Which is not a reason to do range of motion exercises. To protect muscles from atrophy. To lessen the likelihood of pressure ulcers. To maintain mobility. To normalize vital signs. Range of motion exercises maintain joint flexibility and circulation. They do not have a direct clinical effect on normalizing vital signs like blood pressure. Question 75. To whom should you report as a nursing assistant? A licensed physician, the registered nurse, RN, or LPN on your service, the administrative desk person, the dietitian. Nursing assistants work under the license of a nurse. Therefore, they must report all observations and care outcomes to the RN or LPN in charge of the shift. Question 76. What should you do if you make a mistake in charting? Start another chart. Have the supervisor write the correction. Use correction fluid, white out. Draw a single line through it, write error, and initial. Medical records are legal documents. Errors must not be hidden. A single line allows the original entry to remain visible while identifying it as a mistake. Question 77. How should you communicate with a patient who doesn't speak English? Use an interpreter and honor cultural perceptions. Let someone else handle communication. Use only nonverbal gestures. Request the patient be reassigned. Providing quality care requires effective communication via professional interpreters and respecting the cultural norms of the resident regarding touch and eye contact. Question 78. What should you do if a patient has fallen but appears unhurt? Help the patient back to bed immediately. Write a note to your supervisor. Fill out an incident report per facility policy. Tell an administrator about the floor conditions. An incident report must be filed for every fall to document the event, facilitate a medical assessment, and help the facility prevent future occurrences. Question 79. Which should not be done when caring for a patient with an indwelling catheter? The tubing should be secured to the inner thigh. The urethra should be cleansed in a downward circular motion. The patient should be positioned on their side. The bag should be hung below the level of the bladder. When performing catheter care, the patient is usually supine. However, the most important rule is that the drainage bag must never be placed on the floor or above the level of the bladder. Question 80. What is the best way to provide for a patient's spiritual needs? Pray with the patient. Establish rapport and listen to their spiritual views. Alert them to religious services in the facility. Refer them to a religious counselor. Spiritual care is highly individual. Building a relationship and listening allows you to understand what spirituality means to that specific resident. Question 81. A patient being treated for pain has a drop in blood pressure and a rash. What is likely? Anxiety or stress, hypertension, fluid loss, an adverse drug effect from the analgesic. A sudden drop in blood pressure, hypotension, and a rash after medication are signs of a potentially life-threatening allergic reaction or adverse drug effect. Question 82. Under what circumstances should a nursing aide have access to a patient's files? To correct computer information, to show information to family members, for patients currently under their care, for any patient in the facility. Under HIPAA, healthcare workers only have access to the medical records of patients they are currently assigned to care for, the need-to-know rule. Question 83. A resident with Alzheimer's tells the nurse aide that she smells smoke. You should _______. Reassure her that there is no fire. Put her to bed because she is tired. Tell her no one is allowed to smoke. Look around for a fire. Even if a resident is confused, safety concerns must be investigated immediately. You must check for a real hazard before assuming it is a hallucination.